So as we all know that respiratory system provide uh, it is made up of these things. Means there is the larynx, then comes the trachea divided into right and left bronchus, then got the lungs, pleura, and the diaphragm, which is also help in the action of the respiration, right? So this is our basic undergraduate knowledge. I'm not going to deep into that, but one thing that needed to be know that, as we all know, lung this is provide a vital physiological function. Its function is allowing gaseous exchange. So doing that, it is obviously very much in constant battle with the host pathogen and the pollutants. So this is your number one thing. Okay. And other than that, it is also responsible for what? Acid base balance. Okay. So it is also responsible for acid base balance. So obviously respiratory medicine, this is what exemplifies how carefully epidemiology science and the randomized controlled trials has revolutionized our understanding of the common diseases and leading to preventive measures like the BCG vaccination. Introduction of the BCG vaccination basically decreases the rate of childhood TB. To be very specific, here it is mentioned that the rates of the TB in the UK declined, but to be very specific, that rates of the childhood TB also, this is the main thing that is declined after the introduction of the BCG vaccination and even the streptomycin. Okay, so this is the thing that you need to know, and this is what we are going to discuss, right? Okay, so what are the things that is available in our hand? Suppose we are dealing a patient with a chest medicine. Suppose we are in a ward in the chest medicine and we are dealing a patient with some kind of respiratory symptoms or some kind of respiratory pathology. So what are the things that we had under our sleeves, right? So first of all, sputum examination. So sputum examination, this is of two types. One is your examination and another is the test, which is done in the laboratory. Okay.
Sputum examination helps diagnose respiratory infections by analyzing mucus from the lungs, identifying pathogens, inflammation, and abnormal cells for accurate internal medicine evaluation.
This is how my sputum looks. This is the color of my sputum, blah blah blah. But they are most of the time unavailable to show that. So just be aware of that. There are mostly colorless in case of chronic bronchitis, yellow, green, or brown in case of pulmonary infection, red in case of hemoptysis, and black in case of smoke or coal dust, frothy or white pink in case of pulmonary edema. So apart from this thing, this is not going. I am not going to like strain too much in that area. But the main important thing, which is the main thing or main important aspect, is like laboratory diagnosis.
Laboratory diagnosis identifies diseases through blood, urine, and tissue analysis, using advanced instruments to detect abnormalities, guide treatment, and ensure accurate medical decision-making.